Welcome to this predicted paper from Psychology Ninjas. This paper represents the best guess for the upcoming exams. Please use this paper in addition to your other revision. You can complete a unique version of this paper by going to our Psychology Ninjas site. Psychology Ninjas is full of free content to help you with your exams. You can save your scores with a free account. Explain the impact of culture in diagnosing schizophrenia. 2 marks. Here we have the command word explain, which means we need to give a detailed description. The focus of this question is all about culture and the impact of culture on diagnosis. You get 1 mark for identifying the impact of culture or identifying a way in which culture may change diagnosis, and a 2nd mark for then explaining the impact of this or why this occurs. Let's have a look at an answer. The process of diagnosis is more likely in particular cultures as the creation of new words is encouraged. In Rastafarian culture, the creation of new words is encouraged and celebrated, but clinicians may view this as word salad or disorganised speech. We focused on neologism, or the creation of new words, as a thing that might explain how culture has an impact on diagnosis. We've justified this by talking about Rastafarian culture in particular, explaining what their view is and then the view of clinicians. Describe the procedure of your chosen contemporary study for your chosen disorder. In this case, we've gone for anorexia nervosa, and this question is worth 2 marks. Our question has the command word describe, which is asking us to give detail and extension. We want as many examples as we can here to show detailed, thorough knowledge. Our assumed psychological knowledge here is about a procedure. This means exactly what the study did or what the researchers did during that particular investigation. We have 2 marks here, so we want 2 separate bits of the procedure. It's really important here we don't have generic ideas that could apply to any particular piece of research. Let's have a look at our response. Participants were matched for age and educational level, with 25 females from an AN eating disorder clinic and 25 healthy female controls. We have detail in here in terms of the participant variables that they were matched on and the number of participants in the study. It's important here that we've also identified that there were eating disorder patients with anorexia nervosa and healthy controls. Let's discuss another part of the procedure from Guardia et al.'s study. An image of a 2-metre door was projected onto a wall, with the width of the door varied from 30 to 80 centimetres. Participants were asked to judge whether they could fit through the door without turning sideways. We've given specific details in terms of the width of the door and how it was varied in this study. We've also talked about the tasks that our participants were asked to do in terms of judging when they could fit through that door without turning. We could go further here or give an alternative in terms of describing perceived passability ratio or perceived critical aperture instead. Explain 1 strength of your contemporary study for your chosen disorder. 2 marks. This response is going to look at anorexia nervosa. We have the command word explain in this question, which is asking us to give detail and extension within our response. The focus in our question is of a strength of our chosen contemporary study, so we just need 1 strength. We've got 2 marks in this question, so we get 1 mark for identifying a strength of our contemporary study, and it must be specific to that contemporary study and that disorder. We get our 2nd mark for justifying why that is a strength. Now let's go to our response. There is external reliability as research supports that participants with anorexia nervosa are less affected by size-weight illusions than controls. Judgments that smaller objects are heavier, showing similar results to Guardia et al.'s study. We have identified within our response that there is external reliability, and we've explained that by saying there are similar results to that which Guardia et al. Found. We've then justified this by talking about specific research and that those focused on size-weight illusions. We've talked about the results of these studies, saying that smaller objects were found to be heavier by anorexia nervosa patients and were more likely to be found by anorexia nervosa patients than controls. Explain 1 improvement of your contemporary study for your chosen disorder. 2 marks. This response is going to focus on anorexia nervosa and Guardia et al.'s study. In this question, we have the command word explain, which means we need to give detail and extension to our response. We need to focus on giving an improvement to the study. Our first mark is going to be given if we give a specific improvement to the study, how we would make this study better. Our second mark is then to justify why that improvement helps this study, generally with a link to generalisability, reliability, or validity. The AN group could have had an experimenter who more closely resembled their body size and weight, increasing internal validity, ensuring that differences between the first-person perspective and the third-person perspective were not due to confounding variables. We've identified an improvement here by changing the experimenter and having the experimenter more closely fit the body size and weight of the anorexic group. We've then explained why this would be a strength. We've identified that this would prove internal validity or accuracy in the study, and we've said why that's important, so that the differences are not due to confounding variables. Oscar is conducting a study to investigate the relationship between clinical experience and positive interactions with patients. He collects data on the number of years that different clinicians have been qualified. He also conducts cross-sectional research, asking patients to complete questionnaires about their daily experiences in 10 different inpatient facilities. Explain how Oscar could show an awareness of the Health and Care Professionals Council HCPC guidelines for clinical practitioners, 2 marks. Our command word in this question is explain. This means we need to give extension and detail. By doing this, we need to have examples and showing off our psychological knowledge. Our assumed psychological knowledge in this question is of the HCPC guidelines, that we understand what these guidelines are about. Given that this is a STEM question, we also need to link this into Oscar and his particular circumstances that we have been given. Both of our marks here involve application, and so we need 2 separate links to the STEM for the 2 marks that we have available. Let's have a look at a response. Oscar needs to be honest about his findings and report concerns to the General Medical Council if patient questionnaires reveal concerns or disclosures of abuse about their experiences. We've demonstrated our knowledge of the guidelines by saying that Oscar needs to report any concerns. That isn't enough to get our mark, so from here we need to explain how this affects Oscar's particular study, in that he has collected patient questionnaires and these might reveal any concerns. We're going to tick off questionnaires within our STEM to show a variety of use of the STEM and get all those application marks. So there's 2 marks in this question, so we need another way in which the HCPC guidelines might be relevant. He needs to consider the phrasing of his questions carefully to reduce the risk of escalating behaviour or symptoms of the patients in the facility. Again, we've shown our understanding of the HCPC guidelines in terms of reducing the risks for patients. We've linked this into the STEM by having an understanding of clinical symptoms and behaviours, as well as understanding that these patients are in an inpatient facility. So we can tick that off in our STEM, 2 different pieces of application, 2 parts of the STEM, 2 marks for this response. Table 1. Mean number of positive interactions per day and the number of years the clinicians have been qualified. Less than 2, 5.2, 2 to 5, 8.9, more than 5, 4.5. Draw a bar chart to show the mean results of Oscar's study using the data from Table 1, 3 marks. Here we have the command word draw, which means it's looking for us to actually draw out and sketch out this particular bar chart. The first thing we want to do is draw out our axes. And then we want to put a scale on both axes. Now it doesn't really matter which one we do on which axis for the purpose of psychology, but we're going to make our life a little bit easier and we're going to put our mean number, our frequencies up the side. And then we're going to start to plot our points. So we've got 5.2 here. And because we've got a bar chart, we want to leave a space so our bars don't touch. And we're going to put 8.9 about here. And then we're going to put 4.5 in here. And that gets us one of our marks because we've accurately plotted our points. So our next thing to do is label our axis. So this is less than 2, This is between 2 and 5, and this is more than 5. Well, what is this in relation to? Well, this is the number of years of clinician experience. And then we need to label our other axis. So this is the mean, and what is it the mean of? Mean number of positive interactions. And finally, we need to give our whole graph a title. So we're going to say bar chart to show. And we need to put both our IV, and that completes our graph, and also our DV, which completes our graph. Here's one I prepared earlier. Our bars have a gap between them and they are accurately plotted. That's 1 mark. We've got both of our labels operationalised, the number of years for the clinicians being qualified and the mean number of positive interactions per day. We have both our IV, the years of experience of the clinician, and the DV, mean number of positive interactions, in our title. So we get all 3 marks. Oscar is concerned about the reliability of his data, and so decides to ask patients to complete the questionnaire at the beginning and the end of each day. The results from Oscar's investigation are shown in Table 1. Complete Table 1 and calculate the Wilcoxon Sign Ranks test for Oscar's study, 4 marks. So this question is asking us to complete and calculate a particular table. We need to focus here on this being a Wilcoxon Sign Ranks test, and the instructions for this are in the front of the exam booklet. So we need to complete our table, and the first thing we need to do is complete the difference column. This is requiring us to take this column away from this column. So we were looking at 17 minus 4, and that's going to equal 13. We're going to do this all the way down, ensuring that we have the signs included. Our next step is to ignore any differences that are 0, which means this participant D no longer exists for our study. We then need to order our differences from lowest to highest, and this is when we ignore the signs. So we've got 3, 4, 5, 5, and 13. And then we're going to give these all a rank. Now I like to put underneath their ranks if all of these numbers were different. And if we've got any the same, like we do with our 5s, we're going to take the mean of the ranks. That means both of these become 3.5. And we're going to put this back into our table in terms of our ranks. We're then at the next stage within our statistical test, and we need the sum of the ranks if they are positive differences. So that means we're adding together 5, 3.5, and that's it. So our sum of our rank of our positive differences is 8.5. We then do the same for our negative differences. So we're adding 3.5, 2, and 1, which makes 6.5. We then need to determine which one is our Wilcoxon t-value. Whichever of these two sums of the ranks is the lowest becomes our t-value. That's 6.5, so that becomes our calculated value. Oscar used a directional one-tailed hypothesis. The calculated value was 6.5 and the number of participants was 6, with 1 having no difference between the two conditions. State whether Oscar's data were significant at p equals 0.05, 1 mark. The command word here is state, so we're giving a specific sentence about our question. We have some assumed psychological knowledge here in terms of significance, whether these results are from chance or not. We need to use the information from Oscar's study in order to make our response relevant. As one of the participants had no difference, we are actually excluding them from our study completely. So rather than having 6 participants, we've actually got 5 participants taking part in our study. There are some other pieces of information from our STEM that we need for our critical values table. That this is a directional or one-tailed hypothesis, and that the level of significance is 0.05. So we've got a one-tailed test or a directional hypothesis, and we're using a level of significance at 5%, so we're going down this column here. And we had 5 participants in our study because we excluded one that had a difference of 0, which means that our critical value is 0. So the first thing we're going to write in our answer is our critical value, and our critical value was 0. And then we need to identify our calculated value within our STEM, which is 6.5. And we're going to compare these two values in our answer. So 6.5 is bigger than 0. This is going to determine whether our results are significant. So the results are not significant. This is because 6.5 is bigger than 0. It will always tell you at the bottom of the table which way round it needs to be significant. Evaluate biological treatments for your chosen disorder, 8 marks. This response is going to look at anorexia nervosa as a chosen disorder. This question has the command word evaluate. This is still requiring us to do 2 different skills. The first skill we're looking to do is our AO1, or our explanation. Our explanation is going to focus on biological treatments. In this case, that's going to focus on drug treatments as our biological treatment. The remainder of our marks, our AO3, is going to be providing strengths and weaknesses of biological treatments. We're going to use DESERT in order to help us evaluate. We're going to start our response by explaining a particular drug therapy. SSRIs reduce the uptake of serotonin by temporarily blocking the reuptake transporter to make more serotonin available in the synapse. This means that it is more likely to cross the synapse and extending the appetite-enhancing effects of serotonin through repeated binding with the postsynaptic neuron. We've identified a particular drug therapy through selective serotonin reuptake inhibitors, and within our response, we're absolutely fine to abbreviate that to SSRIs. We've talked about the role of SSRIs and how they work, but more importantly, given that SSRIs are also used to treat depression, we've talked about how this is involved in anorexia in terms of increasing or extending the appetite-enhancing effects of this particular neurotransmitter. We're then going to move into evaluation. Drug treatments are directive, as clinicians use their expert power to have social control over their patients. We've identified that the directive nature of drug treatments might be potentially a problem. We've also linked this into a particular issue and debate by talking about expert power and that being a form of social control. We then want to explain how drugs are directive. Clinicians decide both which drugs the patients with anorexia nervosa take and the dosage that may result in them experiencing negative side effects or reduce the likelihood of a positive prognosis. We've clearly explained how drugs use expert power and are directive, talking about both which drug is taken and the dosage. We've talked about the impact of that on the patient as well to extend our knowledge. In order to provide logical chains of reasoning, we're now going to give a counter-argument. However, drug treatments are not directive as the patient with anorexia nervosa decides whether to comply by taking SSRIs or not. Compliance is a really good argument in terms of drug treatments not being directive. It is always the choice of the individual of whether they stick to the regime that's been laid out for them. We want to complete this paragraph by having a mini conclusion. The use of expert power may result in individuals viewing anorexia nervosa as a medical condition, making it an effective treatment based on the symptoms of anorexia that the patient displays. We've clearly explained how expert power is a strength for drug therapies, talking about the view of this as a medical condition and therefore making the treatment more effective. We're going to move back into explanation now in order to balance our response. Atypical second-generation antipsychotics reduce the availability of dopamine by binding to the postsynaptic receptor sites so that dopamine is unable to bind, reducing the likelihood of the neuron firing. As dopamine remains in the synapse, it is more likely to be broken down by the enzyme beta-hydroxylase or be reuptaken. Second-generation antipsychotics are used to treat anorexia nervosa due to their side effect of weight gain and reducing obsessive thoughts about food, body size and shape. We've identified a different drug treatment here, talking about second-generation antipsychotics. We've explained how they work, but more importantly, we've explained why they're used for anorexia rather than schizophrenia. Their side effect of weight gain makes them ideal for anorexic nervosa patients. We've also talked about their effectiveness in terms of reducing those obsessive thoughts. We're going to move back into our evaluation. Research supports the effectiveness of second-generation antipsychotics when treating anorexia nervosa. We're now going to talk about the effectiveness of second-generation antipsychotics. To explain this, we're going to talk about specific research. Boakye et al. Conducted a case study with second-generation antipsychotics and found significant weight gain and less anxiety at mealtimes with few side effects. We've identified specific research here and explained the findings, which is important given that we're using this as evaluation. Other research could be used here, we've just gone for Boakye et al. In order to develop our logical chains of reasoning, we then want to move into a counter-argument. However, the use of case studies means that there is no control group to compare the effectiveness of placebos or second-generation antipsychotics on non-anorexic nervosa patients, making cause and effect problematic to conclude. We've identified or focused on the use of case studies within this piece of research for our counter-argument, specifically talking about the lack of control group, which means that it's unlikely to be able to establish cause and effect, reducing the validity of our conclusions about effectiveness. We're then going to give a final mini conclusion to complete this evaluation paragraph. The effectiveness of second-generation antipsychotics has mixed results, limiting the external reliability of research findings, and so may not be the most appropriate treatment for anorexia nervosa. By focusing on external reliability in our conclusions, we're saying that there is an inconsistency across different participants from different studies. We've also said the impact of this for treating anorexia nervosa. It's now time to go back to explanation once again. Olanzapine is a dopamine antagonist, but also a weak serotonin agonist. It may influence anorexic nervosa symptoms through blocking D2 or D3 receptors and serotonin receptors. It may also have an impact on the secretion of ghrelin, so that the higher levels are promoted, decreasing the feelings of fullness and encouraging food intake in patients. This time we've explained the role of a specific drug, olanzapine. We've been clear here how this works and the different mode of action of this particular dopamine drug. We've also talked about its impact on ghrelin, introducing the hormone in relation to fullness and hunger. Here we've said the clear impact on patients, encouraging more food intake, important for our anorexic nervosa symptoms. It's time to move back into evaluation once again. The use of drug treatments for anorexia nervosa are not without side effects that would require management by the clinician. The focus of our evaluation this time is side effects, really important, especially when we're talking about drug treatments. We're then going to explain a specific side effect for anorexia nervosa. Anorexic nervosa patients may experience a mild to moderate side effect of a dry mouth or headache. They may also experience serious rare side effects like type 2 diabetes. We've identified a range of symptoms here in order to show off our psychological knowledge and discuss a problem with drug treatments. In order to elaborate in our response, we're going to give a counter-argument once again. It is because of their side effects of weight gain that many drugs have been used to treat anorexia nervosa. Focusing on weight gain as a positive side effect of these particular drugs is the reason why we have used them to treat this particular clinical condition. We're going to complete this paragraph by giving a mini conclusion. Side effects may require additional medication and treatment that may reduce the likelihood of AN patients continuing with biological treatments. We've discussed the impact of this in requiring additional medication for their dry mouth, headache or type 2 diabetes, and the potential impact of this. Because we have the command word evaluate, we're going to give a balanced conclusion to complete our response. Clinicians have a significant amount of power to determine the dosage and type of medication administered, creating a power imbalance. Research has been inconsistent as the effectiveness of second-generation antipsychotics may be dependent on the severity of the symptoms and other participant variables for anorexia nervosa. And finally, drug treatments having the side effect of weight gain have a positive application for anorexia nervosa. Anna is interested in understanding how levels of anxiety vary across different age groups in individuals diagnosed with generalized anxiety disorder, GAD. In order to investigate this, Anna conducts a cross-sectional study by recruiting participants from multiple age brackets. Each participant completes a standardized anxiety assessment to identify whether there are age-related differences in the severity or nature of anxiety symptoms reported by the participants. Discuss how Anna could conduct cross-sectional research to examine the impact of age on generalized anxiety disorder, GAD, 8 marks. In this question, we have the command word discuss, which means we are being asked to do 2 separate skills. Firstly, we're being asked to do AO1, or explain, and that's our first skill in this question. We need to explain the features of cross-sectional research, giving details about what this particular research method entails. The other half of the marks for this question are AO2 marks, or application marks. Here, we are looking at applying this information to our STEM about Anna and generalised anxiety disorder. We're going to start by explaining an aspect of cross-sectional research. Cross-sectional research is looking to take a quick snapshot of behaviour in a given population at a particular time. Cross-sectional research needs to take a large sample in order to get a good cross-section of the target population. We've clearly shown that we understand what cross-sectional research is all about, in that it is a snapshot of behaviour. We've also understood that in order for that to be effective, we need a large sample for our study. We're then going to apply this to our particular scenario. Anna will need to gather a sample of participants from different age groups in order to assess levels of anxiety. She could have different categories with established age ranges in order to gather the sample for testing at a single point in time, such as teens 13 to 17, young adults 18 to 29, middle-aged adults 30 to 59, and older adults 60 plus. Here we've identified how we're linking this into our context. By talking about establishing different age groups in terms of anxiety, we've given clear age ranges for our study in order to show developed understanding of this particular aim. We're going to highlight this in our STEM in terms of talking about age-related differences in order to show a variety of application skills. And then it's time to move on to our next piece of explanation about this research method. Cross-sectional research obtains immediate results, making determinations and comparisons between different subgroups within a target population. Questionnaires are often used in order to compare groups as they impose fewer demands on the participants. Again, we've made a slight comparison here to other research methods within clinical psychology, in that cross-sectional research obtains immediate results, whereas longitudinal research isn't going to achieve that. We've gone further and we've explained how that's possible using questionnaires within this particular research method in order to assess our dependent variable. It's time to return once again to our application skills. Anna could use a questionnaire to establish the severity and nature of symptoms reported by the participants. She could use rank scale questions within her questionnaire, such as on a scale of 1 to 10, with 1 being never and 10 being all the time, do you have trouble relaxing? Anna could also list symptoms of GAD, and participants could select whether this is something that they experience. We've shown our application skills here by giving an example of a particular question. It's really important within this question, especially ranked scales questions, that you say which end of the scale is which. Here we've gone for a particular symptom of generalised anxiety disorder. Now, you wouldn't have to know symptoms for any disorder other than your 2 chosen disorders, so that's schizophrenia and then 1 other disorder. We've also given a list of symptoms and we've identified generalised anxiety disorder here in order to extend our application. And again, we're going to tick this off in the STEM, highlighting that we've now identified the severity and nature of anxiety symptoms within those questions that we've talked about. It's time to return back to explanation of that research method. Cross-sectional research can be used to measure how common certain outcomes and exposures are. It is often conducted to examine relationships between variables and develop hypotheses about possible causal links that can be tested in further experimental studies. Again, we've extended our knowledge about cross-sectional research, talking about outcomes and exposures and how this is used to examine relationships. A bit like correlations here, this might be used as a preliminary form of evaluation and research in order to then delve deeper using experimental methods. Time to apply once again. Anna could establish whether age is a participant variable that affects GAD, in order to establish trends in the particular symptoms or severity of anxiety within teens or older adults. Anna's conclusions could lead to the development and exploration of age-tailored therapeutic approaches. So we've really focused our application on the particular aim for Anna's research. We've focused in on generalised anxiety disorders and that developing responses to different age groups. By talking about age-related therapies, we're saying that different age groups might need different therapeutic techniques. Maybe some groups are younger or older groups using medication, whereas the reverse is being true for maybe those talking therapies instead. Again, we're going to highlight in our STEM that we've talked in depth about generalised anxiety disorder, so we can tick off a different part of our STEM showing the breadth of our application skills. And now it's time to explain once again a feature of cross-sectional research. Cross-sectional studies aim to describe a variable rather than measuring it. In clinical psychology, they are frequently utilised to examine associations between exposures, potential causal factors, and outcomes such as psychological disorders, by comparing the prevalence of symptoms or diagnoses between exposed and unexposed populations. So we've developed some of those ideas that we talked about in our previous paragraphs, giving a detailed discussion of what we mean by exposures and what we mean by outcomes. It's important here that we're thinking about the prevalence, and we've said that we're describing this variable rather than necessarily measuring it. We're then going to apply this to our STEM for the final time. Here we're going to talk about Anna is looking to establish whether age is a potential causal factor. If it differs significantly in prevalence across age groups, then it's more likely that age is a causal factor. However, if the nature of symptoms and severity of anxiety is consistent across the age groups, then it is unlikely that to be a causal factor. So our application this time has involved giving some potential findings for Anna's research. We're still looking at age as our primary factor and the thing that Anna's aim is about. Here we've said that if it differs significantly across age groups, then age is having an impact on the severity of symptoms and how the symptoms are being displayed. If it's consistent, i.e. all the age groups are showing similar symptoms or similar severities, then age isn't going to be a factor. Evaluate the contemporary study of Carlsson et al. 2000. Network interactions in schizophrenia. Therapeutic implications. 20 marks. Here we have the command word evaluate, which is slightly sneaky when it comes to Edexcel psychology. What we need to do is first of all explain Carlsson et al.'s study. This means we need to give the aim, procedure, findings and conclusions. There are 8 of our 20 marks for explanation of Carlsson's study, so we need to give a detailed, thorough account. For the remaining 12 marks, we want to give strengths and weaknesses of this particular contemporary study. Let's start with our explanation of this study. Carlsson et al. Aimed to present the current view of the relationship between schizophrenia and dopaminergic dysfunction. They also aimed to explore glutamatergic deficiency as a rival theory to the dopamine hypothesis. Carlsson et al. Conducted a meta-review of studies that had been conducted on different neurotransmitters to explain schizophrenia. We've given a clear understanding of the aim of this piece of research, an exploration of both dopamine and glutamate. We've also included the sample here in that this is a meta-review of different studies, so the studies themselves become the sample. We're then going to go into our evaluation in terms of strengths and weaknesses of this particular piece of research. Carlsson et al.'s meta-review included a range of studies that had both animal and humans as participants, increasing the sample size to explore neural explanations of schizophrenia. We've started with our discussion of generalizability and the fact that both animals and humans were included as participants in the studies that were reviewed. We're going to start by looking at how this might be a problem. The use of animals as participants is reductionist, as the brain functionality of animals, namely mice, is less developed. The role of the mesocortical pathway have been shown to explain negative symptoms experienced by schizophrenic patients, but is less developed in animals, and therefore the conclusions drawn may lack generalizability. The mode of action of neurotransmitters may also be different in animals, with the reduction of dopamine being much more pronounced than studies on human participants. We've identified some key terminology within our explanation, talking about this sample being reductionist, and we could use the term animal reductionism here. More importantly, we've said why this is reductionist, by talking about the impact of the mesocortical pathway, but also the mode of action of neurotransmitters. We're now going to elaborate to show logical chains of reasoning. We could either do this through a counter-argument or a strength of this particular sample, or in this case, we're going to go for a further weakness. Furthermore, in conducting a meta-review, Carlsson et al. Are responsible for the selection of studies that are included within the review, and these may be subject to researcher bias, having been selected solely because they support conclusions about the role of other neurotransmitters. The inclusion of a number of Carlsson's own studies may also be problematic and not reflect the wider publication of evidence on dopamine or glutamate. In our discussion of the sample, we've focused on the fact that this is a meta-review and selection bias within the samples. We've also talked about how the inclusion of Carlsson's research may be problematic. To complete our evaluation paragraph, we're going to come to a judgment, linking the ideas together about generalizability. Therefore, the population validity of Carlsson et al.'s meta-review may be reduced due to its inclusion of animals and the studies selected for review. We've been clear about the impact of this on population validity, which is an alternative term to generalizability. It's now time to go back to our explanation of Carlsson's study, focusing on the procedure. Within their meta-review, Carlsson et al. Included a number of studies that used PET scans to assess the activity of dopamine and glutamate. PET scans inject the participants with a radioactive tracer that dissolves in the bloodstream. The tracer is carried by the blood to the brain, where it concentrates around brain structures that are particularly active. A PET scan detects the radioactivity and converts it into a digital image of the brain, highlighting the active areas in yellow and red. Some PET tracers are designed to bind to receptors on neurons in the brain. They won't be able to do this if certain neurotransmitters are overactive in the brain. Therefore, on a PET scan, these areas will show up as lacking in radioactivity, coloured in green or blue. This discussion of the procedure focuses on the use of PET scans by many of the studies, explaining in clear detail about how PET scans work, with the use of a radioactive tracer, and how this is then detected in images. For Carlsson et al. Study, this particularly was true in terms of binding to neurotransmitters, and therefore for this study, these show up as green or blue, because the dopamine has already bound to the receptor sites, and so the glucose tracer can't do so. If you didn't want to talk about PET scans as a technique, you could talk about a different finding of Carlsson et al. Study instead. As a meta-review, this has lots of different findings, and we can use that to outline the procedure. Now it's time to turn back to evaluation, and we're going to focus on reliability. Carlsson et al.'s meta-review lacks a standardised procedure, as a range of different studies were included in the review. A lack of a standardised procedure is quite often a problem with meta-analyses and meta-reviews. This is why sometimes the findings are inconclusive overall. We then need to explain the point that we've made. They relied on secondary data, and this means that the procedures within studies may vary significantly, both in terms of the nature of the participants, but the nature of the design and the research method used means that results of studies may vary. The inclusion of schizophrenic patients who have recently taken or been withdrawn from antipsychotics may create different conclusions about the role of dopamine. We've been clear how the impact of using secondary data has a consequence for the results. We've been specific in terms of Carlsson's research by talking about the nature of the schizophrenic patients used within the study. As a dopamine antagonist, antipsychotics are going to be problematic when looking at the mode of action of different neurotransmitters. It's now time to give a counter-argument. However, many studies use PET scans that have a standardised administration process in terms of the injection of a glucose tracer and the nature of CPT tasks within the study. The use of different glucose tracers can enable the researchers to target specific neurotransmitters. The standardised procedure of a PET scan gives this study more internal reliability, especially as a lot of studies have used PET scans as their main way of conducting the research. To complete our paragraph on reliability, we're going to give a judgment. Carlsson et al. Study has high internal reliability, with the ability to replicate scans with different participants, or the same participant if an appropriate amount of time has been left between scans. We've used key terminology within our conclusion, talking about the impact of this on internal reliability, or the consistency within a study. We've also talked about replication as another aspect of reliability. It's now time to move on to the findings of Carlsson et al. Study. When you look at the textbook and the notes, you can see that this is going to be the main part of Carlsson's study, especially as this is a meta-review. Carlsson et al. Found that in order to explain schizophrenia through neurotransmitters, researchers need to go beyond looking at dopamine. PCP is a recreational drug that is a glutamate agonist, but has little direct impact on dopamine. However, PCP induces similar symptoms to schizophrenia, suggesting that dopamine is a limited explanation. Glutamate affects GABA, which acts as a brake for the action of dopamine. Therefore, low glutamate may increase or decrease dopamine, which can lead to disruption, producing symptoms associated with schizophrenia. We've given a detailed understanding of this particular finding and how Carlsson et al. Study goes beyond looking at dopamine and focuses on glutamate, with PCP as a particular example. The fact that glutamate is regulating dopamine is also a really important aspect of Carlsson et al.'s research. Let's return once again to our application and our evaluation of this particular study. The identification of the role of glutamate on the regulation of dopamine has a major impact on the development of new drug treatments for schizophrenia. This is clearly a new exploration and a significant positive application for this particular piece of research. We then need to explain this in more detail. Glutamate antagonists could be used to reduce positive symptoms such as disordered thinking and negative symptoms such as flat affect, treating a broader range of patients more effectively and reducing the impact of symptoms experienced by patients. The key part of our explanation is treating a broader range of patients and ones that may not be traditionally reacting well to dopamine-related antagonists or antipsychotics. We're going to explain this in a bit more detail, showing elaboration in our particular evaluation point. Furthermore, developments of new biological treatments may be significant in reducing the side effects experienced by schizophrenic patients and increase compliance with drug therapies. Hill found that large out-of-court settlements have been made for tardive dyskinesia, the uncontrollable movement of the lips, tongue, face, hands and feet, which affects 30% of patients, with 75% of conditions being irreversible. The development of new drug treatments is significant in reducing side effects, and we've discussed tardive dyskinesia as a particular one linked to first-generation antipsychotics. Again, we want to give a link or a judgment about the impact of the application of this particular piece of research. The development of new avenues for treatments suggests that Carlsson et al.'s findings have external validity, having applications for the real world. Whenever we are talking about applications, external validity is always a key idea that we can link to this. Alternatively, you could talk about credibility as well. It's time to go back once again to our explanation, and we're going to talk about another finding from Carlsson et al.'s research. Carlsson et al. Also revisited the dopamine hypothesis, finding additional evidence for the role of hyperdopaminergia in explaining schizophrenia. PET scans showed that the recreational drug amphetamine is a dopamine agonist and enhances schizophrenic-like symptoms compared to controls. Supporting the role of the dopamine hypothesis is another clear finding from Carlsson's study. This time we're looking at a different recreational drug, amphetamines, and how this has an impact on dopamine, but still has schizophrenic-like symptoms. We need to return once again to our evaluation, and this time we're going to focus on validity. The study has high internal validity, with controls placed on extraneous variables enabling cause and effect to be established. When we're talking about internal validity, we're talking about the accuracy within the study. Have the variables been operationalized correctly? Are we controlling extraneous variables in order to have that cause and effect relationship? We're then going to move on and explain some variables that have been controlled. Studies within the review are lab-based, with high levels of control over situational variables such as the environmental stimuli and the use of animals that enable precise amounts of amphetamine to be administered. We've talked about two different controls here, both in terms of the use of a lab study, but also about animals as participants. We're then going to give a counter and argument in terms of validity. However, Carlsson et al. Did not control for gender as a confounding variable that affects the experiences and prevalence of schizophrenia in women. Gogos et al. Found that estrogen has a regulatory effect on glutamate, serotonin and dopamine, and may explain why women are likely to experience onset later and are less likely to be diagnosed with schizophrenia. We've clearly explained gender as a variable that wasn't controlled in Carlsson et al.'s meta-review, and Gogos et al.'s research that suggests that this is significant when explaining schizophrenia. To complete our evaluative paragraph, we're going to make a judgment. The use of scientific methods and high levels of control within the studies included in the meta-review increase the credibility of Carlsson et al.'s conclusions and the role of neurotransmitters on explaining schizophrenia. We've discussed the impact of using a scientific methodology on the credibility of this particular piece of research. Let's return one more time to our explanation of this contemporary study. Carlsson et al. Concluded that more attention should be focused on neurotransmitters other than dopamine, with mechanisms that moderate dopamine activity, such as glutamate, pointing to new glutamate-based therapies to give wider treatment options to schizophrenic patients. We've been clear in our conclusions about the impact of different mechanisms, specifically glutamate, and the impact of this on therapies. Let's continue with our evaluation. We're now going to focus on ethics. The use of secondary data significantly reduces the ethical issues for conducting research with vulnerable clinical patients. One of the main benefits with using secondary data is the lack of ethical issues for the researcher conducting the review. We're then going to explain the impact of this. As Carlsson et al. Used pre-existing findings and published data, there are no direct ethical issues with conducting their research and the exploration of neural mechanisms. The collation of research also enables new avenues to be identified and to demonstrate the cumulative nature of psychological research. We've been clear about the impact of this in terms of new avenues of research and the cumulative nature showing our understanding of psychology as a science. Here we're saying that we're building on the research of other psychologists and previous research in order to develop new conclusions. We're then going to develop our paragraph by giving a counter-argument. However, some of the studies that establish the role of dopamine hypothesis is based on schizophrenic patients having acute episodes who need additional protections and considerations about their ability to give informed consent to participate in research. The inclusion of patients who have severe symptoms may show different responses to drugs to chronic or long-term patients, impacting the conclusions about the need for new drug treatments. We've clearly discussed some issues surrounding including schizophrenic patients who are in the acute stage or the severe stage of their condition. These may be very different to those people who have chronic or long-term schizophrenia. It's now time to come to a final judgment. Therefore, the lack of direct examination of patients and the suggestion of new areas of research suggest that ethics are a considerable strength of Carlsson et al. Study. In order to complete our essay, we want to come to a balanced conclusion. The use of animal studies limits the representativeness of the data collected on the role of dopamine and glutamate, reducing the population validity of Carlsson et al. Study. Carlsson et al. Study has strong internal reliability, with standardized procedures for the studies included in the review. The implications for the developments of new treatments that may support a wider range of schizophrenic patients demonstrates the strong external validity and positive contribution of Carlsson et al. Study for society. The focus on just neural explanations is reductionist and fails to take into account the role of hormones in explaining schizophrenia. And finally, the use of secondary data significantly reduces the ethical impact of conducting research on neurotransmitters. State the aim of your chosen criminal practical, 1 mark. Here we have the command word state, which means we need a simple sentence or statement about this particular area. This is focused on the aim of our practical. This is a statement about the nature of our research or could be phrased as a question. When we're talking about practicals, remember, it just needs to link to an area that you have studied within criminal psychology. The nature of the practical for criminal psychology could be a questionnaire, an interview, or an experiment. Let's have a look at an answer. The aim of my criminal practical was to examine the effect of leading questions on the recall of students. We've clearly got a focus on criminal psychology here in terms of leading questions, and this could have been a questionnaire or indeed an interview or an experiment. Isle has a history of minor criminal offences but has been recently arrested for assault. Isle has a troubled past that includes growing up in a violent neighbourhood, exposure to domestic violence and struggling with anger issues from a young age. Despite several attempts at rehabilitation, they have continued to be picked up by the police due to an inability to control their temper. Describe how grounded theory would explain Isle's criminal behaviour, 2 marks. In this question, we have the command word describe, which means we need to give a detailed, extended explanation here. There is some assumed psychological knowledge in this question that we understand what is meant by grounded theory, and we understand that this links into qualitative data. Finally, we have a stem attached to this question, and so all of our understanding of grounded theory needs to be linked into Isle, and this is an AO2 question. So both of our marks here are AO2, which means we need 2 separate links between grounded theory and our scenario. Here's our response. Qualitative data would be gathered through an interview with Isle about their criminal offences, and through qualitative data analysis, a theory about their minor criminal offences would be developed. So we've shown our understanding of grounded theory by talking about that this is generated through qualitative data analysis, and a way that they could do that is through an interview. We've then linked this into our STEM by talking about the minor criminal offences that Isle has committed. And we're going to tick this off in our STEM to show that we have applied this part of our STEM already. As this question is worth 2 marks, we're then going to give a second idea about grounded theory. Theoretical explanations would emerge to explain why Isle has an inability to control their temper that takes into account their troubled past. So we've shown our knowledge of grounded theory in talking about that our explanations emerge from the data and they only explain the data that we have collected. Again, we've talked about how this links into our particular STEM, talking about controlling Isle's temper and their troubled past. So we're going to tick this off in our STEM, a troubled past, okay, and controlling their temper. So we've shown here clearly that we've got two different applications for the two different parts of our STEM. Explain one weakness of anxiety as a factor affecting eyewitness testimony, 2 marks. Here we have the command word explain, which means we need to give a detailed, extended description. This particular question is focused in on a weakness, so we need problems with the nature of anxiety as a factor. We get 1 of our 2 marks for identifying a weakness with the role of anxiety as a factor, and our 2nd mark for justifying why that is a weakness. Here's an answer. Anxiety lacks external reliability as there are inconsistent findings about the effect of anxiety. Valentine and Mezout found that anxiety negatively affects recall, with 17% of participants correctly identifying the scary man when experiencing high anxiety, compared to 75% when anxiety was lower. However, Christensen and Houbinet found that witnesses who were directly threatened were more accurate in their recall of a bank robbery. We've clearly identified a problem with anxiety as a factor, in that research evidence and the findings from it are inconsistent. We've justified that with comparing research findings using Valentine and Mezout and Christensen and Houbinet. However, you could use other pieces of research as long as their findings are inconsistent. A convenience store was robbed late at night, and the only witness is the cashier, Lisa. Detective James is assigned to interview her, although Lisa has been worried about the incident and has spoken to her friend about the possibility of being interviewed by the police. Describe how cognitive interview could be used to gather information from the witnesses, 3 marks. In this question, we've got the command word describe. Here we want a detailed explanation, and the focus for our question is about cognitive interview. This is some assumed psychological knowledge. We need to understand the process of cognitive interview and the techniques involved. As this is a STEM question, all 3 marks are AO2 or application. So we only get the marks once we start to apply it to the STEM. Just listing or describing the stages of cognitive interview won't help us access the marks for this particular question. Let's have a look at a response. Detective James encourages Lisa to mentally place herself back at the scene of the crime, asking questions such as, try to picture yourself in the store before the robbery happened. What were you doing? What could you hear, see or smell? Lisa would close her eyes and imagine the moment before the suspect entered. By giving example questions as we have done here, we're showing that we are applying our knowledge to the particular STEM. We've also identified here that she would picture the suspect and how this might happen. Let's break down the next part of our response. Detective James avoids leading questions and instead asks Lisa to describe the event in her own words by asking, tell me everything you remember, no matter how small or unimportant it may seem. Here we have a connection between Detective James and Lisa to describe the event. We could be a bit more specific here in terms of explaining what the event was, but we've also got another sample question to show application of how we might use cognitive interview. And then finally, Detective James asked Lisa to record the event in reverse order by using questions such as, let's go backward from when the suspect left. What did you see or hear as he was walking away? We've got a final question here to show our application. This is a slight leading question by including the word he, suggesting that the criminal was a man. So we've got 3 separate links to the STEM using 3 different parts of cognitive interview. Compare the use of case studies with laboratory experiments when examining factors affecting eyewitness testimony, 2 marks. Our command word here is compare, which means we need a similarity and a difference. So we get 1 mark for our similarity and 1 mark for our difference. There is some assumed psychological knowledge here that we understand the difference between case studies and laboratory experiments and the features of these research methods. We're looking for a similarity and a difference between them. We need to also focus on this assessing eyewitness testimony. So we want a link or a relevant statement in relation to those, so it's not viewed as generic. Let's dive into our answer. Both research methods have used quantitative methods to understand factors affecting eyewitness testimony, with the frequency of accurate reports and a mean estimation of speed. So our similarity here is the use of quantitative data, and we've given examples of how this has been assessed. The frequency of accurate reports in our case studies, for example, Wilcoxon, and a mean estimation of speed from Loftus and Palmer's laboratory experiment. We're now going to move into our difference. Case studies have found that misleading information doesn't affect eyewitness testimony, as witnesses of bank robberies recalled accurate information, whereas Loftus and Palmer found that the highest estimations of speed were in the smashed condition. So here we've talked about a difference being found in the impact of misleading information. Again, we've given some findings, we've referenced witnesses to bank robberies for Wilcoxon, and again we could give specific findings for that. And then we've gone for a highest estimate of speed, showing a different outcome for Loftus and Palmer's research. Again, you could give some specific numerical data here if you wanted to. Explain the role of psychological formulation within criminological psychology. 2 marks. Here we have the command word explain, which means we need to give a detailed description. The focus of this question is psychological formulation, so we would need to talk about the different steps within psychological formulation. This is all explanation and knowledge, and therefore all of our marks, both of our 2 marks, are AO1 marks. Let's break down the response. Offence analysis is used to gain insights into the motivations of an offender and the reasons why the offence occurs. Clinicians work on the basis that all behaviours, including offending, serve a purpose for the individual. Treatments are viewed as a work in progress, reflecting the motivations and functions of a particular offender. In this response, we've briefly talked about all 3 stages: offence analysis, the function of offending, and its application to treatments. Corey has a troubled history marked by a series of violent incidences. Growing up in a neighbourhood plagued by gang violence, Corey was exposed to criminal activity from a young age. He fell into the wrong crowd during his teenage years and has been in and out of the criminal justice system for various offences, including assault and armed robbery. Corey gets a rush when he commits crime and craves the excitement that comes with getting caught. Discuss how individual differences might explain Corey's offending behaviour. 8 marks. Here we have the command word discuss. This is asking us to do 2 separate skills within our 8 marks. Firstly, we get 4 marks for our explanation. This is our explanation of individual differences, things that might be different between different people. Sometimes this is also referred to as participant variables. As this is a STEM question, our remaining marks are all about application, how we've linked those individual differences into the STEM, and specifically Corey's offending behaviour. So we're going to start by explaining a particular individual difference. Individual differences in behaviour may be the result of personality differences in the development of an individual's nervous system and their responses to external stimuli. Extroverts have an underactive nervous system, which causes them to crave excitement and requires higher levels of arousal. We've identified personality as an individual difference, giving explicit discussion of Eysenck's personality types, talking in depth about extroverts and how this links into the nervous system. From here, we're going to apply this to the information we've been given. As Corey craves excitement and gets a rush from committing violent crime, this shows that he has an underactive nervous system that needs more external stimuli. This sensation-seeking behaviour may be linked to testosterone levels, making Corey more vulnerable to criminality. So we've linked this back into the STEM and that he gets a rush from committing his crime. We've also identified that actually testosterone levels may increase this level of excitement and extroversion in Corey. We're going to identify that we have used this within our STEM in order to make sure we're using a variety of application skills. We're now going to extend our discussion of individual differences. Personality is based on individual differences in terms of the socialisation process in childhood, which will determine whether the biological basis an individual has in terms of their nervous system results in someone being law-abiding or not. Extroverts are less receptive to operant conditioning and are less affected by punishment for criminal activities. We've extended our discussion of talking about personality as an individual difference by looking at the differences within the socialisation process and that this has an impact on whether someone is law-abiding or not. We've gone into a bit more depth about how this links into extroverts as well. So it's time to apply our knowledge once again. Corey has grown up in a violent neighbourhood, meaning that he's been encouraged to engage in criminal behaviour from a young age. Having been in and out of the criminal justice system, Corey is not receptive to punishment. That is typical of extroverts. So we've talked about socialisation here, particularly that Corey has been in and out of the criminal justice system with lots of different offending behaviour, showing that he's not receptive to punishment and is likely to be extrovert. We're going to highlight this aspect of the STEM, that he's been in and out of the criminal justice system, to show that we're using different parts, boosting our application skills. Let's return to our explanation once again. The self-fulfilling prophecy suggests that labels that are given to people for their behaviour only occur if an individual has internalised or accepts the label that they have been given. Self-fulfilling prophecy is all about accepting a label or internalising it. This is what distinguishes it from labelling theory more broadly. From here, we're going to apply this understanding of self-fulfilling prophecy. Corey has been exposed to violent and criminal behaviour due to growing up in a neighbourhood plagued with gang violence. Corey has internalised the label of being a criminal, and so his criminal behaviour keeps escalating. So here we've talked about a different part of our STEM and where he's growing up and the nature of the neighbourhood being plagued by gang violence. We've returned back up to our STEM to tick this off in order to show our varied and breadth of application. We're going to return once again to explanation of different individual differences. Role models have a significant influence on criminal behaviour, with young offenders being particularly influenced by role models. An individual difference is who you have as a role model and the behaviours that they display. If criminal behaviour is vicariously reinforced and seen to be rewarded, then it is likely to be imitated. By emphasising it's who you have as a role model, we show how social learning theory and role models is an individual difference rather than a social explanation more broadly. And for a final time, we're going to link this to the information we know about Corey. Corey's role models may have been gang members that he has seen being rewarded by power and status, particularly as a teenager, where his peers are more likely to have a significant impact on his behaviour. So we've identified particular role models that Corey might have and a particular time in which these might be influential. And we've returned back up to our STEM once again, and we're going to highlight this, that he fell into the wrong crowd during his teenage years, but also that this is likely to be or potentially be gang violence based on where he's grown up. In our STEM here at the top, we can see our 4 different colours for our 4 pieces of application, and that these are using different aspects of the STEM to give a cohesive and breadth of application skills. Farah was charged with embezzlement and fraud. She was accused of stealing $200,000 from the company where she worked for the past 5 years. Farah, who had no prior criminal record, maintained her innocence, claiming that the discrepancies in the accounts were due to clerical errors and not intentional theft. Farah's barrister has instructed her to wear some makeup and have her hair done each day for court, but to limit her interactions with the court because of her Birmingham accent. Assess how factors affecting jury decision-making might impact Farah's trial, 16 marks. With the command word assess, we need to ensure that we give judgments throughout our response. For our 16 marks, we're going to start with our explanation, and we have 6 marks of explanation. our explanation is focusing on factors affecting jury decision making. Because we have our STEM, we also need to link this back into information about FARA. There are 4 marks for our application skills. Our final 6 marks are coming from our evaluation of our different factors, our strengths and weaknesses, and how we present these different factors. We're going to start by explaining one of our factors affecting jury decision making. Race is a factor in jury decision making due to in-group bias, where jurors of the same ethnicity as the defendant are more likely to vote not guilty. Jurors see themselves in those who are the same ethnicity and therefore would need a higher burden of proof to convict. We've clearly identified race or ethnicity as a factor in jury decision making, and we've gone a step further explaining how this links to in-group bias. We've also been really clear about the impact or outcome of this. So if they're the same ethnicity, more likely to vote not guilty, and why that is in terms of a higher burden of proof being needed. We're going to move on to application. If FARA has a jury that is not the same ethnicity, then an outgroup bias is likely to occur, especially if she's a black defendant with a white jury. We've identified a different relationship in terms of FARA for our application, talking about outgroup bias this time, and if she's likely to be a black defendant with a white jury, she's more likely to be found guilty. Returning to our STEM here, we don't have any information about FARA's ethnicity, and so we need to be careful not to go beyond the STEM and give FARA a whole backstory that we haven't been given. We have made a reasonable expectation here in terms of just giving a different point of view in terms of outgroup bias. It's now time to move on to evaluation and our AO3 skills. There is supporting research for the role of race on jury decision making. We've clearly identified a strength here and talked about supporting research. We could use empiricism as well as a different alternative term. And then we're going to explain our research. Bradbury and Williams analysed data from real criminal trials in the US, finding that predominantly white juries were more likely to convict black defendants. The impact was more significant for specific crimes such as drug offences. When we're doing our explanation, we need to go beyond just identifying pieces of research to show that we understand the nature of it. We've talked about specific findings here, talking about predominantly white juries being more likely to convict black defendants, and we've shown detail in that we understood that these were more significant results when it came to drug offences. Be really careful, especially if you've selected Bradbury and Williams for your contemporary study for criminal psychology. We don't want a big description here, we need to focus on findings because we're using this for evaluation. We're then going to give a counter-argument. However, just recording conviction rates lacks external validity, as when defendants face multiple charges in the same trials, defendants have been found guilty of some charges but innocent of others. We've identified that recording conviction rates is problematic for this piece of research, but also other pieces of research examining factors affecting jury decision making. We've said that this lacks external validity and that it cannot be applied to real life, and we've explained why that is a problem and justified this weakness. And now it's time to link this back into our STEM. As FARA is charged with embezzlement and fraud, the makeup of the jury may have a less significant impact than Bradbury and Williams' research suggests. So we've linked this back into the STEM, identifying the nature of FARA's charges. We've then said the impact of our understanding of Bradbury and Williams and how this is less significant in this particular instance. We've gone back up to our STEM to tick this part of our application off to ensure we're using different parts of the STEM for different parts of our application. It's now time to move on to a different factor affecting jury decision making. The attractiveness leniency hypothesis suggests that an attractive defendant are more likely to have a not guilty verdict. This is due to the halo effect, where they are presumed to be good people because they are good looking. Attractiveness is another factor affecting jury decision making, and we've talked about the attractiveness leniency hypothesis that more attractive people are treated more leniently. We've also linked this into our wider knowledge from social psychology about the halo effect. It's time to apply now. FARA's barrister has suggested that she wear makeup and have her hair done to look more attractive so that the halo effect will occur for the jury. We've clearly identified aspects of the STEM here in terms of her wearing makeup and having her hair done. We've linked this back into our factor, saying this would make her more attractive. We've returned to our STEM here in order to tick this off to ensure we're using different aspects for our different factors. It's now time to evaluate attractiveness as a factor. The attractiveness leniency hypothesis lacks external reliability. This means that there is a lack of consistent results across different participants. We're now going to discuss research evidence. Patry found that mock juries that discussed the case were more likely to find an attractive defendant guilty, opposing the attractiveness leniency hypothesis. We've both identified our research here and talked about specific findings. Given that we've identified external reliability being a problem, we would need to discuss more than one piece of research. However, Abavenda and Howe found that female participants were more lenient towards an attractive female defendant and less lenient towards an unattractive female defendant, though male participants displayed the opposite tendency. Abavenda and Howe's research supports the attractiveness leniency hypothesis, particularly with the female participants. However, our male participants did not agree with the attractiveness leniency hypothesis. It's time to come to a judgment about attractiveness in order to respond to our command word, assess. The suggestions by Farah's barrister may only have an impact on a predominantly female jury, and therefore may only have a limited impact on the jury's decision. We've been clear in our judgment here, talking about its limited impact of attractiveness as a factor. It's time to move on to a different factor. Regional accents are likely to have juries give a guilty verdict due to stereotypes and schemas surrounding their behaviour. Although we've identified accents as a factor, we've also explained why this might be causing juries to return a guilty verdict, talking about stereotypes linked into schemas from cognitive psychology, which has a change in our behaviour as a jury member. It's then time to go back to our application skills. As Farah has a Birmingham accent, she is more likely to have a guilty verdict recorded, and so her barrister has got her to limit the amount of time she speaks. We're going to highlight the Birmingham accent because that's given to us in our STEM. We're also going to highlight as application that the barrister's actions in relation to this regional accent. We've returned once again to our STEM, and we're going to highlight that the Birmingham accent has now been discussed as application. We're going to return to evaluation skills now. There is research to support that regional accents have an impact on jury decision making. Again, we've identified research as part of our credibility for this particular factor. It's time to back up this statement with some specific research evidence. Here we're going to talk about Dixon et al. Found significantly higher ratings of guilt in relation to a Birmingham accent rather than a standard British accent. Our specific findings here show that we understand the nature of this particular piece of research. In order to develop logical chains of reasoning, we then want to give a counter-argument. On the other hand, Dixon used a conversation between a suspect and a policeman. Therefore, participants did not have the same level of consequentiality or burden of proof that might be seen in a real trial. It's important here where we're talking about a problem with the research method in that it is a conversation used between the two confederates within the study. It's important that we then say the impact of this on real jury decision making. Here we've talked about that this means that we wouldn't have the same level of proof or burden of proof in this particular instance, and so participants might be more likely to say that someone's guilty when they might be unsure. If they were unsure in a trial, they would be returning a not guilty verdict. Let's return to give a judgment once again, this time on accent. The impact of her Birmingham accent would depend on where the trial was held, but given that the barrister is limiting her speaking, it is likely that the jury is not from Birmingham. Here our judgment is dependent on where the trial is being taken place, and it's absolutely fine to kind of sit on the fence and give both sides of an argument in our particular judgments. However, we've gone a little bit further here and we've used our STEM to say that actually it's likely that this is not taking place, or the trial is not taking place in Birmingham, because they're being limited in how much interaction she has with the jury. Back to explanation now, and to talk about a fourth factor. Gender may also play a role, as female jurors are more likely to convict than male jurors, regardless of the gender of the defendant or whether it is a mock or real trial. We've identified gender as a factor here, talking about female juries being more likely to convict and the circumstances in which they're more likely to convict. It's time for some application once again. Farah would want a jury to have more males in order to increase the likelihood that she is not found guilty. We've made a determination of the impact of this on Farah specifically, saying that she would want a jury to have more males. However, we want to be cautious about this because there's no reference of the jury makeup in our STEM. Let's evaluate gender as our final factor. There are a significant range of other factors that might influence the jury, including personal experience of the offence, whether there is a charismatic leader having a minority influence on the jury, or personality traits of the jurors. A range of other factors have been identified as different things to consider within jury decision making, suggesting that our discussion of the factors that we've talked about so far is not an exhaustive list. We're going to explore this a little bit further. Ash found that minority influence was significant when a Confederate incorrectly said out loud a response in a visual perception test matching lines. We've discussed one of these factors in more detail using research. We focused in on Ash's research, giving specific findings here and linking this into minority influence as our particular other factor. We're going to extend our discussion to give a logical chain of reasoning by using application of all of this information on juries. Furthermore, research into factors affecting jury decision making means that jurors are reminded to be impartial. And when jurors were given instructions that they had to find a defendant guilty beyond a reasonable doubt, racial bias disappeared. We've shown our wider knowledge here and the impact of our understanding, that jurors are reminded to be impartial, and when they are, racial bias disappears. To reflect the command word assess, we want to come to another judgment. It is important that Farah's barrister has the judge remind the jury of their duties and has jurors removed that may not be impartial based on their personal experiences. We've linked this into the STEM by talking about what the barrister should do. We're going to complete our response by coming to some final judgments to reflect that command word. There is empiricism to support the role of different factors affecting jury decision making. The use of mock trials to examine jury decision making is problematic and therefore conclusions lack credibility. Gender, personal experiences of the jury and personality of a single jury member may also affect jury decision making, so juries have to be looked at holistically. There is significant applications to criminal trials showing the importance of the instructions given to a jury. You can complete a unique version of this paper by going to our Psychology Ninjas site. Psychology Ninjas is full of free content to help you with your exams. You can save your scores with a free account.